have already discussed about the blood pressure regulation, I have mentioned that our blood pressure is regulated in two ways. One is short-term regulation of blood pressure and another is long-term regulation of blood pressure. So first my aim is to tell you the mechanism behind short-term regulation of blood pressure. So first I want to show you the neuronal mechanism, neuronal circuit behind short-term regulation of blood pressure. Look at this diagram, please. This diagram here, this is our brain and spinal cord. Here, this is the medulla, pons, midbrain, and the cerebral cortex, cerebellum, and this side it is the spinal cord. Now here is a small diagram. In this I have drawn the diagram of the heart along with specialized conducting tissues of the heart. This is SA node, this is AV node, and then we have internodal pathways, and then Bachmann's bundle. This Bachmann's bundle, as you all know, this bundle is responsible to carry electrical impulse from SN to AV node, and this electrical impulse is ultimately responsible to contract the muscle of left atrium. And then we have AV node. This is the only electrical window of the heart, and this AV node will have the different pathways for the left ventricle, that is right bundle branch, left bundle branch, and then Purkinje fibers. Now the blood is pumped by the left ventricle. This is the aorta. This is the aorta. This comes under major arteries. This is aorta. And this is the branch of aorta. We call it carotid artery. So here it is made such a way, just like a balloon-like structure you can see here, that we call it carotid sinus. So aortic sinus and carotid sinus. Wall of the carotid sinus and aortic sinus will have the receptors, pressure receptors, high pressure receptors, that is baroreceptors. जो रिसेप्टर हमारे बॉडी में हाई प्रेशर के वक्त देयर इज एनी ऑल्टरेशन विद द प्रेशर मे बी 20 millimeter mercury, 25 millimeter mercury, major changes are there. At that time, these receptors are stimulated, already I have told you. And then we have the nerve ending here, and this nerve ending actually is responsible to carry the alteration with the pressure. So sensation is being picked up by the nerve ending of the glossopharyngeal nerve, ninth cranial nerve, and here also we will have the nerve ending, and this nerve ending will carry information in the form of action potential, and ultimately about the pressure status of our pressure will be relayed to the nucleus, tractus solitarius, or we call it sensory area. Now here I would like to again tell you how these nerve endings are stimulated. See here, if we again draw the diagram about the carotid sinus, see this diagram here. Here this is the carotid sinus, where the nerve ending, if we draw the nerve ending, here we have the nerve ending, here we have the nerve ending which are supposed to carry the sensation of pressure, blood pressure. Now as soon as pressure is increased, then this membrane is stretched. As soon as blood pressure is increased, then there is a stretching with the wall of the carotid artery. Because of this, if it is the nerve ending, then we have here sodium channel. We have here sodium channel. I am drawing the diagram of sodium channel, and because of stretching means this will be pulled like this, so there is a stretching. Because of this, there will be opening of the sodium channel. This channel is sodium channel. Because of the stretching, because pressure is increased, stretching is there, so the sodium ion will come inside. So inside we will have more positive charges. Once it is more positive charges, then as we all know, the resting membrane potential is minus 70 millivolt. And this minus 70 millivolt will be changed to minus 60 millivolt, minus 40 millivolt, like this. So there will be a depolarization. And this depolarization, when many depolarizations are united, there is a formation of action potential that I have mentioned here. Now, another important aspect you have to consider, that these informations are being collected by the nucleus tractus solitarius. That is the central relay station, central modulator, central coordinator, not modulator, central coordinator. And this nucleus tractus solitarius, once it is stimulated because of increased blood pressure, then what will happen? There will be a stimulation of cardio-inhibitory center. This cardio-inhibitory center through vagus, this will control the activity of SA node. So there will be more secretion of acetylcholine. Now at the same time, there will be inhibition of cardio-acceleratory center. Cardio-accelerator is inhibited because of the stimulation of nucleus tractus solitarius, and due to that, there is a center of sympathetic, and this sympathetic is inhibited, so the norepinephrine secretion will be less. Here there will be an acetylcholine secretion will be less, and followed by the norepinephrine secretion will be less. And this nucleus tractus solitarius also it can inhibit the vasomotor center, and this vasomotor center, again we have the lateral horn of spinal cord, that is the center of sympathetic, and this sympathetic is inhibited. This sympathetic is inhibited. This is inhibited. So there will be a less secretion of norepinephrine here, and again it has a connection, supply or control the venous system. It also can control the activity of arteries. Activity of arteries means whether there is a contraction or dilatation. So because of this stimulation of vasomotor center, there is a arterial dilation. Arteriodilation is there, and this is the vasodilatation is there because of less secretion of norepinephrine here. Here because of less secretion of norepinephrine here, and again it has a control on activity of adrenal gland. So this adrenal gland will secrete norepinephrine, so there will be less secretion of norepinephrine. So what will happen? Norepinephrine mediated arteriodilation, norepinephrine mediated vasodilatation, norepinephrine mediated negative inotropic effect. And then another also pathway we can see with the kidney, so there will be less secretion of renin. So this is the pathway we can see whenever there is a reflex, maybe a baroreflex, maybe a chemoreceptor reflex, maybe a volume reflex, Bainbridge reflex. So everywhere this pathway is involved. Here this is the afferent and this is the efferent. That is the parasympathetic and this is the sympathetic.